Hey, this is Jonathan coming at you on this video from my home office down in Camarillo. This is a place I see a few private clients, usually on alternate Fridays when I'm off from my job at the county mental health clinic, or on Saturdays. And I wanted to take a little bit of time to give you an overview of the course that you'll be participating in this quarter, Psychopharmacology for Therapists, and just talk a little bit further about why I am instructing in this class, and see if this camera also works a little better than the one that I used in the first video. So the class is divided into 3 segments. The first portion, weeks 1, 2, and 3, we're going to go over a bunch of foundational materials. Sometimes I'll be talking to you from the camera like this. Occasionally I'll use the camera to show you something on the computer screen or some materials, but hopefully you'll get some key information in a fresher fashion than just reading the textbook or supplemental materials that way. So I'll also be patching in and putting on online some recorded conversations between psychiatrists later on in the course when they are discussing with one another medication options and how they go about the process of deciding who it is or what medication is going to be optimal for a given patient. I think you're going to find that really interesting. So weeks 1, 2, and 3, as I said, we look at some foundational materials, information, and give you that overview of learning some key terms and concepts, definitions. We'll make sure you understand what it means to titrate a medication, upwards or downwards. We'll talk about agonists and antagonists, neurotransmitters, psychopharmacokinetics, and much of background information of that sort. We're also going to spend a little time in the first 3 weeks learning about how medications are discovered and developed, tested, approved, and brought to market. So I think having an understanding of that process will also give you a better grip on what's involved really in facilitating this biological intervention on behalf of our clients. Weeks 4, 5, and 6 are really the core of the course, I think, in most people's minds. In those weeks we will be studying specific diagnostic categories and the medications that are used to assist the clients who are suffering from mood disorders, including bipolar illness and the depressive spectrum of disorders. We'll have a week where we look at anxiety disorders, psychotic conditions, and another week and the antipsychotic medications, and then finally we'll spend some time looking at attention deficit disorder and that family of conditions and the medications used for them. So during those weeks we'll be eavesdropping on some psychiatrists as they talk about their selection of medications and the pros and cons of different options in different diagnostic situations. We'll also then in weeks 9 and 10 have a little bit of additional material to look at. We'll have 1 week where we look at complementary and alternative medications. Complementary medications are things such as dietary supplements and so on. Alternative medications are maybe herbal remedies and things of that sort. We want to be aware of these things. They're not regulated by the FDA, but our patients are often aware of them. They may be using them. Sometimes psychiatrists or other physicians or other people have recommended them, and so we want to be aware of what's being done in those fields. Finally, week 10 is going to be devoted to honing our skills in communicating with clients and with doctors with clarity and with understanding in terms of medications, side effects, positive therapeutic effects to be looking for, all these kinds of things. So we'll spend the last week looking at that. In terms of your coursework, each week typically there's going to be a discussion forum posted. It will go up by early Monday morning, I guess, or Sunday night. You'll have all week to respond to it. They'll often be closed by Friday night. I'll post the details on that and make it clear so that you know at what point you won't be able to put your comments up. Each one of those will be worth up to 10 points, and you'll be responding to me and to at least one classmate in your postings week by week. Weeks 2 through 10, there are additionally going to be assignments. Okay, these are not going to be submitted for your classmates to read and react to. They will be submitted directly to me, and these will typically be worth 10 points except for week 8. In week 8, there's going to be a larger project where you'll actually go out and interview somebody, do some research on complementary or alternative medications, and that assignment is going to be worth up to 40 points. You'll get the details on that as we come up towards week 8. It will be something that you will be able to complete relatively promptly, but you'll have a bit of extra time to manage that project. There's going to be a final exam. It will be a take-home exam worth up to I believe it's 80 points, and you'll get all the details again on this, but you will be dealing with vignettes addressing common client situations and doctors, and helping you to really get confident in how to interact with patients and physicians around the issues of medication, and so that will be something that you can finish by the end of week 10. That will be the due date, so it won't be a tremendously complicated or protracted assignment for you. I know you're going to have a lot to do as the quarter comes to a conclusion. That will be open starting the beginning of week 10, so you'll complete the entire project during week 10. The textbook I already mentioned, 7th edition of Psychopharmacology for Therapists, the Essentials of Psychopharmacology, and it's a good text. I think you'll get a lot out of it. I would recommend keeping it as a future reference, but that's just my recommendation, obviously. I personally have been, I graduated from your school with my master's in clinical psychology as a returnee after being out of the academic world for about 30 years. My undergraduate work was in psychology at University of California, Santa Barbara. I minored in chemistry. After I graduated from that program, I sold my soul to the big farm industry and worked as a what we called a detail man, discussing medications with general practitioners, internists, and psychiatrists throughout the Tri-Counties area for about 7 years. And we at that time marketed a tricyclic antidepressant, a couple of hypnotic agents, sleep-inducing agents, and an anti-anxiety medication. So I had a fair amount of training in those areas, although many new medications since then have been released, and but it was interesting to see the pharmaceutical industry from the inside, everything from R&D, manufacturing, and then distribution and promotion. So I've got a little bit of that in my background also. I graduated from Antioch in the end of 2003, worked in domestic violence solutions and what used to be called the Fellowship Club on Chapala Street. Now it's the Mental Wellness Center down on Garden Street. From there, was hired by the County of Santa Barbara, where I've worked for closing in on 10 years. I became team supervisor, essentially the clinic manager of the Kyrial Adult Outpatient Clinic in Santa Barbara, and that setting has really helped me to be prepared for this particular course, because the team I supervise and interact with daily consists of 2 psychiatrists, a registered nurse, 5 practitioners, 2 case managers, substance abuse specialist, a peer recovery specialist, a vocational rehab specialist, and a few additional supplemental staff. So on a daily basis I interact with MDs, and we in our team meetings often discuss the appropriateness of medications, or what kind of medications. The doctors are pretty open in sharing with us their reasoning processes and hearing from us suggestions or observations that help them to make the ultimate decision. So I look forward to sharing with you what I've learned in my academic training and my experience, and I think you're going to find it really helps you to feel more confident as you ultimately go out and bear responsibility for providing quality care for people that really need help with their emotional, psychological, relational issues and concerns. Okay, so keep your eyes posted on for emails and for the discussion groups that are going to be opening every single week, and for your first assignment, which will be up by the end of this weekend. Okay, thank you.